Okay, so one other really big important step when we are trying to set up our area is that we need to constantly think about positioning. So we want to have any items that we may need or want to use during our transfer, we need to have those close to us. This helps to ensure patient safety as well as our own safety. We have things right there readily accessible. We can easily grab them and use them. So what we're going to talk about now would be a supine to sit and then into a wheelchair transfer. So the patient is supine in the bed, and we're going to talk about the best ways in which to get them into a seated position. We can get them into the wheelchair, transfer them in that manner, and still preserve our own back. Anytime we are working with a patient, we would want to raise the bed to our waist level or thereabouts. Anytime we're in a hospital setting, we have that luxury of being able to raise that bed. So for these purposes, we are going to simulate that this bed has been raised so that I can complete any type of patient care that I would need to. If I were to need to help them to be cleaned up, have a bed bath, anything to that nature, I'm able to do that, but I would want to have the bed up here about my waist height. That way I'm not bending over to reach my patient. So once we have gotten the patient to, we're ready for them to have their transfer, the best thing we can do, we would want to have that bed lowered. Obviously, we want as low to the floor as possible to prevent any fall or injury to them. So we would have our patient come towards us, and they're going to roll onto their side, kind of like a log roll. And then depending on your patient's ability and level, the more you're going to have to assist, the more chance or the more likelihood of a possible injury to yourself. So if you've got a patient that is not able to help as much, you want them log rolled onto the side, let them get your hands under shoulder, legs, and then help them on up. Okay? So then you've got them sitting at the edge of the bed. You would want to lower the bed to where their feet are right here on the floor. You would want to have your chair positioned to where it makes the most easy transition. So oftentimes that means having the bed just a bit higher than the surface you're going to. That does make that a little bit easier. So then when we want to stand, we would, again, patient's feet shoulder width apart. You put your foot inside of their 2 feet, 1 foot behind. That gives you a good base of support. You've got good balance, and then you're going to go in. You always want to count to 3 so the patient knows what's coming. And you're going to go 1, 2, 3, stand up. And then again, you are scooting your feet. You're not twisting. And then you're coming down. And you come down with your patient by bending your knees.